Hello, Justin Brock back with Johnny Brock. We're the Medicare Brothers, and we're here to answer another of the top Googled Medicare questions out there. And today's question is, are Medicare Advantage ads misleading? And the answer is yes, they are. And the answer is yes, because it's easy for us to say that because we don't really go out advertising Medicare Advantage. We write Medicare Advantage, and there are certainly times where Medicare Advantage is the best thing for someone, for sure. But many of the ads advertise benefits first, like additional benefits like dental, vision, hearing, without talking about the core portions of the plan. And to someone who isn't educated on it, they could think, well, I want those benefits, but I don't want to give up my health coverage. And if they're on a Medicare supplement or some sort of group plan, they could be giving those up to get the extra benefits and not really be aware of that. Also, they advertise free money. They advertise $170 Part B give backs and things like that. That part can be very, very misleading. And so that's why we try to advertise general Medicare or Medigap plans. It's much less misleading. And then when we get in the conversation and find out someone is a Medicare Advantage prospect, that's when we would pivot to that.
Yeah, it's important to note with the Part B give back is that they know what they're doing. So when they send out an advertising for, $170 back on your Part B premium, they know that most of you will not qualify for that, right? But they're using that as a way into the door, figuratively and literally speaking. But they want to pique your interest so that you can reply in some way and give them a permission to contact you, so that they can build a relationship with you and sell you on something. So it's important to note that, the Part B give back is, unless you're a low income subsidy person, then you're most likely not going to qualify for that. Unless you're a veteran, then there's some other veteran focused plans for you.
There are Centers for Medicare and Medicaid Services compliance guidelines and rules against bait and switching, but it's often been that they have a rule against baiting someone in with a Medicare supplement ad in order to sell the majority of those people a Medicare Advantage plan. Unfortunately, some of the rules that they're coming out with aren't really protecting the consumer from baiting and switching from a Part B give back to a standard Medicare Advantage plan that does not include a Part B give back, or that is not anywhere near what they're advertising, the $170.10. Normally the $170.10 or the $170 that would come back to you would be if you qualified for Medicaid. There's not very many plans in the entire country that have just a free Part B give back that would come without qualifying for Medicaid. So the ads are very misleading, and that's why you need people that aren't misleading, like the Medicare Brothers here at BobbyBrockInsurance.com, where we treat everybody like they're in our backyard.